Hello, Dr. Gray. I'm so glad to have run into you here. Uh, as the Chief of General Medicine here at Norfolk Grace General Hospital, I am sure you are just as concerned as any of us about the potential of our patients contracting nosocomial infections while they're here in our care. And I would really love 2.5 to 3 minutes to just sit down and discuss this with you, and hopefully find a plan for how we can move forward and have less of these. I'm a nurse at the Advanced Heart Failure Unit, and as I'm sure you are aware, we have a large number, almost all of our patients really, who are already at an increased risk of getting these infections due to their status of pre and post transplant, heart transplant specifically, which means most of them, many of them, are on ventricular assistive devices. They have chest tubes, they have indwelling catheters, dialysis catheters, all of these access points that are going directly from the outside into the body, especially when they're going directly to the heart and the bloodstream. So, with that being said, I am a big proponent as anybody about trying to stop any of these infections or potential infections before they happen. However, I have noticed a trend of some providers who will prescribe very harsh IV antibiotics based solely on one lab and not really taking a broader look at the patient as a whole. For example, they see one rising lactic acid and they want us to hang, vancomycin or 2 or 3 other subsequent antibiotics. When we have patients who are already possibly going into multiple organ failure or their organs are generally not perfusing, etc., this could really wipe out their entire probiotic colonies and really put them at an increased risk than they were before of contracting one of these really terrible infections and then everything going even more downhill. I would love if you and I could sit down and possibly create a program so that something like like the pop-ups that we get as nurses prior to giving certain medications like total parenteral nutrition, etc. I think that would be extremely helpful in us not contributing further to these infections. But again, I would love if you could take a few minutes with me to hopefully get this ball rolling. Okay? Thank you so much. I hope to hear from you soon. Bye-bye. Enjoy your lunch.